We're joined by MLA and spokesperson of the Aam Aadmi Party, Raghav Chadha. Thank you so much for speaking to NDTV. The number of cases just exploding in the national capital and the number of deaths remains a big worry. Tell us more about the measures taken. Also, that order of shutting down markets was then rolled back a few hours later.
Look, first of all, yes, in the months of August, September and October, we did see that the positivity rate in Delhi had stabilized and it was hovering between 5 to 7%, which is considered to be, as stipulated by the WHO, that the pandemic was well within control. But of course, unfortunately, with the rising levels of air pollution, with a certain amount of pandemic fatigue, and also in some parts of the city, there were certain violations with respect to the social distancing norms. We did see that there was an abnormal spike in the positive cases, and the positivity rate peaked on the 7th of November when it touched 15.5%. And of course, subsequent to that, there were several political as well as administrative interventions made by the Arvind Kejriwal government, as a result of which I'm happy to report that the positivity rate has started coming down from 15.5% on the 7th of November. It has started dipping. It came to 14.5, then 14, then 13. It is now hovering around 11%. So the graph is, of course, downwards. We are hoping it will further decline. And as far as these markets and these shops and these public places are concerned, I would like to bring to your notice that the Disaster Management Act is in force in the entire country, as a result of which it's the union government that gives a broad skeleton, a set of do's and don'ts, a set of prescriptions to each state government. And it's with respect to that the state government permits or disallows activities in the respective states. So it is actually, the guidelines issued by the center are the precursor for any sort of kickstarting of the economic activity or the marketplaces in Delhi. As far as the fatality rate is concerned, Gargi, I don't think there's anyone who can justify the numbers, the statistics. Of course, in the last few days, we have seen that the number of deaths in Delhi have increased. But if you were to look at this in a perspective, at a through the prism of the fatality ratio, you would find that the death rate or the fatality rate in cities like Mumbai, Kolkata, Ludhiana, Ahmedabad, which is the highest in the country, are far greater than Delhi. Delhi has roughly 1.5 mortality rate.
If we come back to restrictions or ways of controlling, several states have announced night curfews, they've announced restrictions. Many have asked why we're not seeing some such firm measures in Delhi as well. At least it brings back a sense of discipline to the public.
Look, quite frankly, we don't believe in this concept of intermittent lockdown or these night curfews or a perpetual state of lockdown. I think these are measures which serve no purpose. In fact, they actually destroy the livelihoods apart from, destroying even the lives of people. And quite frankly, it's not that, that the COVID-19 virus spreads only after sunset, or it's only in the nighttime or in the evening that this virus goes up and about.
Well, that's when, socializing or unnecessary movement of people takes place. A lot of doctors that we're speaking to point out that Delhi can keep announcing more COVID beds and more, ICUs, but where are you going to get the nurses and doctors?
Right. So as far as nurses and doctors are concerned, as you already know, yesterday the Honorable Chief Minister passed a regulation, took a policy decision that all MBBS students, including those who practice in various fields of science, medical science, can now be roped in as healthcare workers, as frontline workers in hospitals. This has been already done in countries like the US and countries like Germany, Italy, Spain, so on and so forth. Now it is also being done in Delhi because we have realized, of course, that there is going to be a bottleneck when it comes to our healthcare staff. And of course, our healthcare workers, which are the warriors in this fight against COVID, are overstretched. Now, apart from that, as far as the question regarding night curfews and all is concerned, let me just tell you that what we certainly require, and not just in Delhi, across the country, is strict enforcement of social distancing protocols, masks, so on and so forth. Closing down economic activity, shutting down markets, putting on curfews, I think is a pervasive way of trying to combat COVID-19, and that is perhaps the last resort. as far as, in conclusion, let me say this, Gargi, let's not look at COVID-19 as a Delhi outbreak. It's not a Delhi pandemic. It's not even a national pandemic. It's an international pandemic. So therefore, while of course a lot of focus is there on Delhi, I would certainly wish to bring this to your notice that Delhi perhaps is the best performing cities in the country. It has a very most acclaimed model of home isolation. We started the first plasma bank. The per million testing that is happening in Delhi is by far the highest in the country. So it's probably because we are testing more that you are seeing transparently the spike in the COVID-19 cases in various parts of the country. Even, abysmal numbers of per million testing are being reported. So as a result of which you are not getting a transparent picture of what's happening in those cities and states. So I think in Delhi in that sense is much, much better.